Hello everyone, this sketch is about osteoarthritis, and this scene is taking place at a mechanic shop named it's Tio Arthur Mechanic Shop. Tio in Spanish means uncle, and Uncle Arthur is of Hispanic heritage, and that is why he chose to name his shop Tio Arthur. Tio Arthur Mechanic Shop. Another reason that he chose that name, it's Tio Arthur sounds like osteoarthritis. Osteoarthritis, Tio Arthur. I don't know why he was thinking of osteoarthritis, but he's considerate, let's say, of our education, so he chose that name. And it is happening at a mechanic shop rather than a candy shop. Why is that? A mechanic shop, to remind you that osteoarthritis is a mechanic process. A mechanic process opposed to an inflammatory process like in rheumatoid arthritis, which is an inflammatory process that would have signs of inflammation like swelling, redness, pain, erythema, and inflammatory markers, etc., which are absent in osteoarthritis. And that is to, again, to remind you that this is a mechanic, not an inflammatory process. So, why did I choose this event to take place at nighttime? Is it because I am a night person? Maybe, but I chose that because mechanic processes are usually worse with activity and better with rest. Worse with activity, so are worse at night time and end of the day. And this is opposite of inflammatory processes like rheumatoid arthritis. So, what are the risk factors for osteoarthritis and who does it affect? I decided to represent that by Uncle Tio Arthur right here. So, Tio Arthur, as you can see, he is a man in his early 60s, maybe late 50s, around that, and he's a little bit chubby and he has just fallen. So, why is that? One, he is that age group. Increased age is associated with osteoarthritis, more common like with age over 50, over 60, and chubby because obesity is a risk factor, and he has fallen because injuries could also be a risk factor. For example, if he got an ACL injury, that could predispose for future osteoarthritis. So why did he fall in this way? He fell in his back and in his hips, and this to remind you that the joints most affected by osteoarthritis are weight-bearing joints, like the hip, like the spine, like the knee, and maybe the neck as well and shoulder. So remember, hip, spine, and knee. And also to give you another clue, I made his niece come give him a visit. Niece for knees, knees. Like that is why I brought the knees. Sounds very similar. So knees are affected in osteoarthritis. So if you look at the car right here, for what did I make a car again? To remind you that a car uh, damage to cartilage is what degeneration of cartilage is what happens in osteoarthritis, and that's why I chose a car rather than a motorcycle, for example. Yeah, anyway, see. So the car is coming off an accident, and in an accident, think about an accident. Would you expect the damage to be symmetrical? Probably not. I mean, it could be, right? But what are the chances? So, osteoarthritis is usually unilateral. It affects one side, and this is what happened to the car right here. And this is what happened to Theo Arthur, unfortunately. So, to remind you, osteoarthritis, it affects weight-bearing joints unilaterally. So, and what are also common presenting or things that you could see in osteoarthritis? You could see nodes in your phalanges, interphalangeal joints. For example, Bouchard nodes at the proximal interphalangeal joints, and I represented that by this guy here. The receptionist name is Bo, and he has a chart behind him. The chart behind him is to help him keep track of bookkeeping, etc. So Bose chart, say that a few times, and you will associate with Bouchard nodes. Bouchard nodes. What are the other types of nodes that you would see? You would see Heberdean nodes at the distal interphalangeal joints. So I made this car a hybrid car. A hybrid car, as you can see here, hybrid Heberdean. It is not exactly the same, but it's very like it's kind of sounds similar. Hybrid and Heberdean. So now we have finished talking about the presentation of osteoarthritis. Let me talk about diagnosis. Diagnosis is usually confirmed with an X-ray, which will show four findings characteristically. One is joint narrowing, two osteophytes, which are bone spurs, and three subchondral sclerosis, and four subchondral cysts. And if you look at this space right here, you will see that this space has narrowed, and that to remind you of narrowing that happens between that this is characteristic of osteoarthritis. Also, you will see subchondral cysts, and you will see bone spurs, which are osteophytes, and you will see subchondral sclerosis. And to give you another memory cue, I made Theo Arthur mad as he has fallen and he is yelling. He is fighting. He is ready to fight. So Theo is ready to fight. Osteophyte. Osteophyte is the name of the bony spurs. Osteophyte. Theo is ready to fight. Theo fight. Theo fights, say a few times and you will remember that. So now moving on. We have talked about presentation and diagnosis. Let's talk about treatment. Treatment usually is with pain medications like acetaminophen or NSAIDs. And if you look at this this TV show right here, every time I want to represent NSAIDs in one of my sketches, I will make a proposal scene, as you can see here. And this one, it might look different from what you would expect. And that is because in an ideal world, women make the first move. And this woman has proposed to her lover of a long time, but he said no. You know what else starts with an N? NSAIDs. N said no, just flip the letters. So NSAIDs are represented by said no. He said no. And why did I make it, besides trying to make a certain point, why did I make the women propose, not the man? And that remind you of osteoarthritis affecting women more than men. Disproportionately. So, and besides NSAIDs, if it is severe, also we can give cortisone shots, and that is represented by the niece holding the candy right here. Candy to remind you of glucocorticoids. And why did I make the niece hold it? The niece is because usually cortisone shots can be given in different joints, but a knees specifically, and you don't want to give them in hip injuries. So after that, you can go, if none of these works, maybe you could consider like surgical options like knee or hip replacement. That's pretty much all. Thank you all for watching.